Hello, everyone. It's Wednesday, November the 15th, and we've got a lot to report to you. I'll move along as quickly as I possibly can. We have had additional deaths in West Virginia of 28 more deaths since Monday. We all know the severity. Some probably don't take it with the level of seriousness that we should. For the most part, you know, the overwhelming majority of our people are taking this very, very seriously. Unfortunately, today, the only bullet in the gun that we really have at this point in time is one of two things. One, which I am not in favor of at all, and that would be just a wholesale shutdown of all kinds of businesses and schools and everything all across our state. I am not in favor of that at all. The other is today we can test and continue to test more, and we can wear a mask. Just wear a mask. I mean, whether you believe in it or don't believe in it, we're all inconvenienced by it. And we all know that we're on a short fuse to be able to get to that vaccine. And as I've told you repeatedly, over and over and over and over, we've got to get to the vaccine. And so if you're inconvenienced, if you don't believe in it, please wear it. I mean, please wear it. What's the downside? What's the downside? You know, really and truly, if it never worked a bit on the planet, what is the downside? An inconvenience? Now, and if you have breathing problems, we've told you over and over and over, we don't expect you to wear a mask. But today, that is really the only bullet in the gun that I've got. Very, very soon, we hope and pray. We hope and pray with all in us we'll have the vaccine, and very quickly we will start trending out of this. But right now, just like on Monday, 28 more West Virginians dead. 28 more. We're 695 deaths in the state of West Virginia now. It's terrible. It's a crying shame. Our 668th death, a 94-year-old male from Wayne County. And as I always read all these, please just take the time to think, what if this was your grandma, grandfather, friend, dad? Just think how much this would hurt. So please, all of us, send up as many prayers as we can for all these people. Like I said, a 94-year-old male from Wayne County. Our 668th death. Our 669th death, a 78-year-old female from Cabell County. Our 670th death, a 70-year-old male from Fayette County. Our 671st death, an 80-year-old male from Mineral County. Our 672nd death, a 74-year-old female from Marshall County. Our 673rd death, a 90-year-old female from Mineral County. And get this, everybody. Our 674th death, a 35-year-old female from Ohio County. Our 675th death, an 84-year-old female from Marion County. Our 676th death, an 87-year-old female from Wood County. Our 677th death, a 92-year-old female from Ritchie County. Our 678th death, a 79-year-old male from Wood County. Our 679th death, a 70-year-old female from Kanawha County. Our 680th death, an 81-year-old male from Kanawha County. Our 681st death, a 70-year-old male from Mineral County. Our 682nd death, an 83-year-old male from Mingo County. Our 683rd death, an 84-year-old female from Cabell County. Our 684th death, a 97-year-old female from Mineral County. Incredible life, and God bless her. Our 685th death, a 73-year-old male from Mineral County. Our 686th death, an 84-year-old female from Harrison County. Our 687th death, an 80-year-old female from Mineral County. Our 688th death, a 68-year-old male from Marshall County. Our 689th death, a 76-year-old male from Marshall County. Our 690th death, a 95-year-old male from Marshall County. Our 691st death, an 86-year-old female from Marshall County. Our 692nd death, an 83-year-old male from Marshall County. Our 693rd death, a 94-year-old female from Marshall County. Our 694th death, a 93-year-old female from Marshall County. And our 695th death, an 80-year-old male from Cabell County. You know, it's a time of year that we give thanks in so many ways. And we should all give thanks for all the wisdom and all the goodness that these great West Virginians have given us over and over and over. We'll miss them. We'll miss them more than I'll never, ever sit here and say, I know what you're going through, because I don't know what you're going through. I know that it's bad, and I want us to always remember and not let these people become a number. We've had 967 new positive cases in the last 24 hours. Our daily positive rate is at 4.81. Our cumulative rate continues to go up. It's at 3.53. The total active cases in West Virginia today are 14,283, and recovered cases are 28,072. In just a second, I want to get back to this chart just one second, but we have a record high hospitalized people of 510 patients in our hospitals right now. We have 144 in our ICU units. Yesterday in the state of West Virginia, we tested 15,518 people, and our daily or our effective reproduction number, our RT number, is at 1.04. And get this, I'm reading 28 more people that have died. I'm reading positivity numbers that are not good. And yet we are the 19th best RT rating in the country. Our country is really, really experiencing a real whiplash of this terrible killer. And we're not immune in West Virginia. We have 4 counties now in the red: Marshall, Mineral, Wirt, and Wyoming counties. We have 15 counties in the orange, and they're Hancock, Brook, Ohio, Barber, Grant, Hampshire, Jefferson, Berkeley, Ritchie, Wood, Jackson, Mason, Putnam, Mingo, and Boone counties. According to Johns Hopkins, yesterday in this country, 2,100 people died of COVID. Can you just imagine? Can you imagine what that multiplier becomes if we continue on that rate through an entire year? That number becomes, I think, if I'm doing the math correctly and everything, that number becomes 735 or 750,000 people. Our daily cases of COVID in this nation have not dipped below 100,000 positive cases a day in 3 weeks, and for the 15th consecutive day, West Virginia continues over and over and over to set, the United States continues over and over and over to set a new record in hospitalizations. We now have more than 88,000 patients in this country that are hospitalized. Our airports since last Friday, there's been 4.8 million people that have flown. Last year at this time, there was 11.7 million that flew. The difference is, surely you can do the math, but the difference is way less than half of last year. However, we've had every warning in the world about travel that maybe we ought not to be doing that right now. There was a thing that came out on the news just the other day. I wanted you to see this and everything and watch only because of one thing, and that is this. I had many, many people that were calling, and they were saying to me over and over and over, we want to be like South Dakota. We want to be South Dakota. Well, I don't want to be South Dakota. I don't want to be South Dakota. And this is probably the most accurate thing that I think you could see about South Dakota, if you could see that now.
Thank you, Maria. We take you now to South Dakota, a state that has reported more COVID hospitalizations and deaths over the last week per capita than anywhere else in the country. CBS's David Begnaud is there.
Here in Sioux Falls, mask wearing is now mandatory, says Mayor Paul Tenhaken.
But there's no enforcement behind it.
If you think that the enforcement piece is going to all of a sudden create this mass level of compliance that isn't there without it, that's not true.
I am an RN on a COVID unit.
That is 22-year-old Nicole Noshel.
I do care about other people and their health as well.
South Dakota's Governor Kristi Noem is against mask mandates, despite the fact that per capita, South Dakota leads the world in COVID deaths every day. Health officials are split over how best to respond to the pandemic.
It's hard for me to say we are at a crisis.
Would you classify what is happening here in the Dakotas as a crisis?
I would.
Just about an hour north of here, the city of Brookings reports the lowest infection rate in South Dakota. Now, masks have been mandatory here since early September.
There are a lot of folks in South Dakota, thousands of people in South Dakota, that understand the reality of what we're facing.
Back in Sioux Falls, the mayor has taken some heat for saying this when we asked him why so many people are against wearing a mask.
This is cowboy country, man, and you try and tell someone to do something and they want to do the opposite.
David Begnaud, CBS News, Sioux Falls, South Dakota.
I don't know how in the world that we could have any desire whatsoever to be South Dakota, where they have led the entire world. Now, I know that we're strong-willed people in West Virginia, and we have our rights, and no one is trying to infringe on your rights in any way. Nobody's doing that. Everybody's trying to do just the opposite. Everybody's trying to do all in our power that we can possibly do to be able to keep our businesses open and thriving and moving forward in all our job opportunities, our schools, everything. I just don't have any other bullets in the gun. I don't have any other bullets. Look right there. The most profound thing of all that was said is in a little community called Brookings. In Brookings, South Dakota, they have been wearing their mask since September. And they have the lowest infection rate of anywhere in the state. And to say it doesn't work? Are you kidding me? Of course it works. And all the medical team that I listen to every day is pushing and pushing and pushing. Now look, we're not wanting to take anybody's rights. My good Lord, I get it wholeheartedly. We don't want to do that in any way. But you got to help me. You got to help me right now. Please, please help me. I'm going to give you a vaccine update and everything. The first batch of vaccine will be coming from Pfizer. It should arrive in West Virginia probably sometime around between the 10th and the 12th of December. The first batch of Moderna is going to come out shortly after that. Both the vaccines, you have to take 2 shots. That doesn't mean a shot today, a shot tomorrow, a shot today, a shot now, and a shot in an hour. They're 3 to 4 weeks difference. I think Pfizer is 21 days. You know, Moderna is 28 days. So you get a shot on the 1st of January, you've got to come back, you've got to get another shot. If it's Pfizer on the 21st, everybody will be advised of this, and Moderna will be on the 28th. But nevertheless, it is very important that those that are going to be vaccinated, and I'll promise you, the very second that I can get the vaccine, I'll be taking it, as well as my family, in every way. Because one thing that we can count on our people about is this: the people, you know, that are to Food and Drug Administration, or all the different people that are overseeing and looking at this, from CDC to everybody. I'll promise you, they have absolutely gone through this to the very, very best of all their abilities. So as far as the vaccine plan, well, General Hoyer's heading up that effort, and the Guard is leading the charge, and we got this down pat, and we'll be getting this out. You know, I mean, they'll be doing a phenomenal job there. They're ready to go, and we just hope and pray that more and more and more will be flowing right into West Virginia and flowing our way to be able to vaccinate our people. Because just listen to me on this. It's just as simple as this. For this disease to survive, it's got to hop from A to B to C. And if you interrupt that hop, it can't survive. In other words, if there's 3 people in a chain and one of them is vaccinated and it can't hop there, it'll never get to C. And so really and truly, that's the key to killing this. That's the key to dropping this right in its tracks. Again, I've done everything I can possibly do to get you to wear your mask. It is absolutely so important. Please do. If you need a sign, you know, we've got the signs up here, and we'll be able to get signs to your businesses, and all you got to do is call us. From the free testing map, you know, we've got, you know, now we've got a map up of the different locations where we'll be, and naturally we'll be in the hotter spots and everything, and we encourage you in every way to go out and get tested. We thank our drive-through pharmacy people. Fruth and Walgreens have been wonderful, and we thank them so much, and continue to look at going there and everything if that's more handy for you. Our schools today. Let's talk just a second about our schools. You know, I have said it, no matter how hard we try or don't try, whatever the situation may be, to have our kids do virtual learning, and that's it. You know, at the end of the day, there are kids that their parents just aren't able to be there every minute and really help them and everything as they go. In other words, basically become a substitute teacher. Some families can pull it off, but overwhelmingly, we're really failing with virtual learning all across this country and in West Virginia as well. We all know how vital it is for our kids to be in school from the standpoint, especially those that are in need, whether it be special needs or people that just need to, you know, kids that need talked to or you know, and an opportunity for us to put eyes on them. But we know hands down, listen to this, there's 24 outbreaks now with 106 confirmed cases in our public schools. Now, when you quantify that into a percentage level, if I'm correct in this, we've got somewhere around 250,000 kids that are out there, and 40,000 plus or minus, you know, service personnel and or teachers. And when you put them all together and say you got 106 cases, well, to be perfectly honest, I don't know that there's a place much safer, period, than in our schools. And so we want to try with all in us to keep our kids in school. We can't, I mean, every single person alive is telling us that we're running off and losing our children, with what is going to happen to their education, let alone all the different needs categories that I talked about. We got to keep our schools open. We got to keep our businesses open. We got to keep our people working. But the only way that we can pull that off today is we got to do all the things that I've been preaching till I'm blue-green. And then on top of all that, we got to get to this vaccine and hope and pray everything will just get worked out. We've got 101 outbreaks in our long-term care facilities. We have 22 outbreaks in 16 counties in our churches. Those 16 counties are Berkeley, Cabell, Fayette, Harrison, Jackson, Kanawha, Logan, Marion, Mingo, Monroe, Preston, Raleigh, Taylor, Wayne, Wood, and Wyoming counties. You've heard me over and over and over tell you what I think about church, and I think it is wonderful beyond belief. I am a Christian through and through. I understand wholeheartedly the need and the desire and the want and everything, but if you happen to be an elderly person that can get your church services online, please consider to do so. An update on corrections. The Stevens Correctional Center in McDowell County is down to 8 inmate cases and 5 staff cases. Outside of Stevens, there's 48 inmate cases and 39 staff cases in the state. The amazing thing about this is it should tell us everything. Is just the fact that we have a problem, we run to the fire, the problem goes whoosh, and the problem goes all the way across the land. It literally, instantly, we went from almost none to 266 inmates infected. Well, we've really worked it hard. It's a great, great tribute to our corrections, our DHHR, the National Guard, and the health departments, and all the good stuff that they've done. We do now have 23 inmate cases at Denmark. At Pruneytown, we have 13 inmate cases. At the Parkersburg Correctional Center and Northern Correctional Facilities, they have 11 each. And we continue to sanitize and run to the fire and do all the things that we're going to continue to do. So our performance within corrections has been unbelievably good, unbelievable. Those people deserve our protection as well. The flu vaccines are available. I've said it over and over. There's no point in going back through that. Please get your flu shot. We have now awarded $191 million, almost $487,000 to our counties and our cities. It's been a big, big boost for our counties and cities. Continue to apply. We've got until probably about December the 15th, and at that point in time, we're going to have to stop because you've got to get it through the process and everything else. So if you really have the need, get at it. Please get at it and try to get, apply, because we've got to have these dollars out the door by December the 30th. I want to talk just a second about some really wonderful things that happened. Well, first of all, I want to talk about the whales announcement that we came up with, and that's not whales in the ocean, that's whales the country. But Blue Rock Manufacturing, is working and is going to establish a new facility for the development of energy cells. These new energy cells, this is really innovative. The Wales people have, I think, purchased the building. They're in the process. This is a go. This is an absolute go. Now, I don't know how quickly if for sure we will, but they believe, this is one that really and truly, this is a perfect example of chasing something. We've done this for 3 years. We have worked this for 3 years. The Wales people, and I think they're DST Innovations, but they absolutely believe that they're going to ramp up to 1,000 new jobs in West Virginia. It's phenomenal. It's unbelievable. And they're going to do it at both ends of our state. They're going to manufacture their products in the northern part of the state, and they're going to take coal in our southern part of our state and establish a facility there that basically takes coal and processes it and brings it all the way down from a ton into a shoebox. Transport the shoebox for manufacturing, and absolutely many of our coal miners will derive help from this, but the facility will absolutely be located in southern West Virginia to be able to work that to where that carbon will be available in a situation to where they can make energy cells. So this was a gigantic announcement for anybody that missed it and everything. It's wonderful to announce a new international partnership in West Virginia. This is a big deal. This is a great, great big deal. And I want to make sure that everybody heard that again and everything. But in addition to that, yesterday, and these are three back-to-back great deals for West Virginia and everything. Yesterday, WVU Medicine transplant organ donation, they came up and they did something that was phenomenal. It's the first dual organ transplant at Ruby Memorial Hospital. The patient received both a new heart and a new kidney by an unnamed donor. The delicate and complex transplants took 9.5 hours to pull off with 9 doctors involved, an absolute miracle beyond belief. And, we're blessed so much to have these incredible medical professionals right here in West Virginia. And so many, many thanks go out to the WVU team and all the great, great medical staffs all across our state. We're doing neat stuff in West Virginia. And for this person to have received a new heart and a new kidney, we wish them, Godspeed for recovery and absolutely the greatest. So yeah, West Virginia, great work. The other thing I've got to announce is yesterday our National Guard was honored beyond belief. I mean, you just think about it. We all know how great our National Guard is, but as we compete and as we're in the process of, we've got our C-130 planes up there, and those planes are getting some age on them, and they're probably 30 years old at this time, and they've come out with a C-130 that's a souped-up model and everything. It's called a C-130J Super Hercules. Well, it's coming out, and the federal government is going to decide, I guess through our Defense Department and everything, they decide where these are going to go. Well, we've been in the race and everything and looking and all that kind of stuff. But lo and behold, yesterday, the United States Air Force announced that the 130th Air Wing, located at the West Virginia Air National Guard Base in Charleston, has been selected as the preferred alternative to convert to the C-130J-30 Super Hercules. Again, I congratulate our Guard in every way. Our 130th Airlift Wing, what an achievement. You've got to be really, really proud. What an honor. There's no way I could be happier for West Virginia and the National Guard for all that they've done on a national level, all across the world that they do. And I truly, truly mean this from every bit of me. We know how great we really are. We know that in every way. But the world is beginning to know it just as fast in every way as we know it. I say it over and over. The world, not just the country, the world is now knowing that we're the diamond in the rough they missed. West Virginia, where right here I'm telling you about whales coming to West Virginia, the great country of whales, and all that they're coming, and they're coming with the intent of bringing 1,000 jobs to West Virginia. Not counting all the fallout jobs, that would be produced by the guy driving a truck on a coal operation or the guy driving a bulldozer or a continuous miner. Not counting those. They're talking about the possibility of bringing 1,000 jobs to West Virginia. And think about the same guy that's telling you on the same day that WVU Medicine has pulled off the first 2-organ transplant in a day, a heart and a kidney to one person. 9 doctors, 9.5 hours of work. It's unbelievable, unbelievable. And in the same day, the same guy is sitting here telling you of an achievement from our National Guard that's off the chart. Not only are we going to have these incredible planes here in West Virginia, but we're going to have more jobs. We're going to have more people and more jobs. We're going to have more guardsmen and ladies. Absolutely, it is going to happen right here in West Virginia because everybody is discovering exactly what I just said, that diamond in the rough that they missed. That's all I've got. It's a lot of stuff. I've got one last thing. I'm sorry. I've got one last thing. You know, tomorrow is Thanksgiving. And you got a lot of moving parts, don't we? We've got a lot of things going on. We got people dying right and left, and we've got sadness beyond belief, and we've got people that we pray for over and over every day. I'm speaking really now of Kathy and I. And Kathy and I really want to step back and just tell you just this. We see the good things that are happening in West Virginia too. And we see all the good things that have happened over the last several years and everything. And this state's really running and really going good. But at the same time, we see all the sadness too. And we see the fact that there's people out there that are still really hurting. And we want to continue to flip every rock until we've helped and tried to identify every one of those people in every way. You got a lot of situations that are happening right now. And tomorrow's Thanksgiving. I would just tell you from Kathy and I that we wish you the happiest of all Thanksgivings as best it can possibly be. We're always at our best in the darkest hours. Anybody can run up the mountain when all things are good. The question is, can you run up the mountain when things are really tough? Now, things have been really tough in West Virginia. I would tell you to be really careful at Thanksgiving. I would tell you absolutely be with your families. This idea of regulating how many you should be with and everything else, that's ridiculous. Be with your families. Enjoy your families. Try as best you can to wear a mask when you can, if need be. If your family is bigger than 8 or 10 people, especially, try to. Or absolutely just wash your hands. Don't get up in each other's face, and you don't have to do that. You can have all the fun and enjoy all the greatness of this incredible holiday. But take time to pray for those that are really less fortunate. And if you can help a neighbor or a senior or whatever, do so. There's lots and lots of different ways to be able to, reach out and help. So a really incredible holiday. And I wish you the very, very best and the very best in every way I possibly can. I recognize that things are tough, but I know that West Virginians, when things are tough, suck it up. And they are really able to perform. We'll get through this. And there'll be a lot of bright days ahead. But we want to be at our best when things are tough. And right now, things are tough. Just try as best you can to enjoy tomorrow. And all my love and God's blessing upon all of you. So thank you so much.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good morning. I want to follow up on and give a little bit more information related to what the governor's tasked us to do with the vaccine distribution initiative and the program. We will be taking the work of an advisory council that was put together within DHHR and a lot of great work by staff there, as well as a number of people from across agencies and across the state of West Virginia who provided input to the documents that we will now operationalize and be prepared to execute going forward. Governor has given us two initial priorities. One is to work to identify where we can best administer initial vaccines and understand they will come in small chunks of vaccination, but to focus on mitigating fatalities, which means we will begin an initial focus in nursing home facilities, as we know that 44% to almost 50% at times during this pandemic of our fatalities have come from those facilities, and also to maintain the integrity of our healthcare system, particularly our acute care system, because we know as the governor points out, we are an exceptionally vulnerable population without the coronavirus. We are in a time of the year when health systems can continue to be work to their maximum capacity to take care of our vulnerable citizens, exclusive of coronavirus. So we will focus on those two areas based on his guidance and direction. We will be rolling out more information as we go forward. I also want folks to understand the Pfizer vaccine. It's great that we will be getting it, but we need to understand it is a complicated vaccine to distribute. It has environmental issues related to temperature. The doses have to be broken down once they come to the state of West Virginia. So a lot of work will be done in that area to meet the objectives. It will be a whole of government and a whole of West Virginia approach. We will need everybody to help us and assist us going forward. And we appreciate the assistance that we're getting right now from a variety of folks across the state of West Virginia. Last thing I'd leave you with, I know in these times we talk a lot about rights and as citizens of this country and this state. I would also, on behalf of all the guardsmen and all the healthcare workers on the front line and EMS workers, police and fire, let us think about our responsibility as citizens, our responsibility to do what we can individually to mitigate the spread of this virus, which is sometimes uncomfortable for us. And also look at the responsibility, as the governor points out, of the vulnerable population, the people you know in your neighborhood or the friends or family you know. Let's take care of those folks. That's what we as West Virginians do. We take on the responsibility. We've been doing it even before we were a state, as is evident by the National Guard and our lineage going back to 1735. So on behalf of all the folks in the West Virginia National Guard and our families, we wish you a happy and blessed Thanksgiving, and please stay safe.
All right, thank you, General.
Just 1 second. I just want to add one other thing, just a little follow-up and everything, that as it comes to me, and it hadn't come to me yet and everything, but I'll be issuing an executive order, that's standing up this task force next week in regard to the vaccine, and it'll be way ahead, of when the vaccine needs to be here. But I just want to let everybody know that an executive order will be issued standing that task force up.
All right, next we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I think the governor has really stated very well, as has General Hoyer, about how all of us feel about the great state of West Virginia and about all of you. And we are so appreciative and thankful for the great efforts that we are doing as a state. We come on these briefs and give you a lot of information. Recently, perhaps not so positive information about what's going on with COVID-19 around the country and around West Virginia. But despite COVID-19 now growing with transmission, with hospitalizations, and even with deaths, West Virginia, you've done really well. And as we think about the many things that we are thankful for in this holiday coming up, I am very thankful for the governor's leadership, for our team that is functioning so well during this pandemic, but particularly I'm so thankful for being with the great citizens of West Virginia who do deeply care about each other. And although we may have differences, and those differences sometimes may cause us to stand on an opposite side of the street, eventually we all answer the call. We've done that for many, many years, and we'll continue to do that. So I have the greatest faith in each one of you. I have the greatest amount of thanks for your actions, for your caring for each other. And despite us being challenged all by this pandemic, I know that West Virginia is going to continue to be a beacon for the rest of the country. So thank you. Have a wonderful holiday tomorrow. And we've talked a lot about how to be safe, but particularly during this holiday season, be really mindful of each other and treat each other with kindness, even if you don't agree exactly with what somebody else thinks, because ultimately we are all West Virginians. And in order for us to thrive, as the governor said many times, we need to continue to pull the rope together. And that is the secret. And that's the reason why we've been doing so well so far. So thank you very much.
All right, thank you, Dr. Marsh. Next to Secretary Bill Crouch with the West Virginia DHHR.
Hello, everyone. This is a time of thanks for all we have and for our family and for our friends. But for many, this is a time of loneliness and isolation. So please check on your family members who may be isolating. Check on your neighbors. Let's make sure everyone has a safe Thanksgiving. Had a question last week about numbers that could be used to contact help for the state. I think we'll have those on the screen. We have Help 304 is West Virginia's emotional strength line. Crisis counselors are available for stress management and referrals. Help 4WV is a substance use disorder and behavioral health issues line. And the National Suicide Prevention Lifeline is on the screen, where help is always available. The Bureau for Senior Services also suggests that seniors who may be home alone contact your local county senior service provider. Often these providers will provide meal services, shopping services, transportation, telephone reassurance, medical appointment transport, and Facebook and Zoom activities. So not all counties provide the same service, but these centers are available, I believe, in every county. The county center list is available at the Bureau's website, which is www.westvirginia or wvseniorservices.gov. That is www.wvseniorservices.gov. Please help keep each other safe these next few days. Please wear your mask. That's our vaccine until we can get a vaccine. I wish you all a safe and happy Thanksgiving.
Thank you, Secretary. And finally to Dr. Ayn Amjad, our State Health Officer.
Thank you. I do want to add, we are talking about Thanksgiving tomorrow, and Secretary Crouch mentioned about your neighbors. And I do want to clarify, Paul asked me on the last briefing about bringing food to your neighbors, and speaking about Thanksgiving being tomorrow. It is okay to bring food to your neighbor's house. I do want to make sure I speak a little bit clearer on that, because I probably wasn't. So if you want to bring food to your neighbor's house, of course, while you're preparing it, make sure the person who's preparing it is not sick. And you can bring that to your neighbor's house, but I would still meet your neighbor outside of their home with your masks on, properly socially distanced. But it is safe to bring something that you prepared with your family. If you want to bring them, the turkey and some sides and dishes like that to check on them. Thanksgiving is traditionally a family holiday. Your neighbor, if they live alone, maybe did not get to travel to see their children or their loved ones. So Thanksgiving is a family holiday. Neighbors do normally see each other, share food. Maybe they are not comfortable coming into your home, or maybe if the weather is good tomorrow, people are going to do some celebrations on their deck or outside. But I don't want to give that misunderstanding that you cannot share the food. COVID-19 is an aerosolized virus. It's not shared on food. We have not seen any transmission on food products. So I do want to make myself clear with that. We got several questions afterwards, but I hope everyone has a safe Thanksgiving as well with their families. And afterwards, if you're having any problems, please get, with your doctors or get tested. Thank you.
Thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Happy Thanksgiving to all of you. I'm thankful for the work that you do. I know that might sound corny and I'm sucking up, but I mean it genuinely. So thank you for what you're doing. I've been looking at research and statistics and polls, both on past vaccinations for the flu and on future projections for the COVID vaccination as far as participation. I know in 2018, the CDC estimated that only about 43 or 46% of West Virginians got the flu vaccine 2 years ago. The numbers are higher for the COVID vaccine, but still about 3/4 are saying they'll only take it if it proves to be 50% effective. Right now, the pharmaceutical companies are saying they're 90 to 95% effective, so that shouldn't be a problem. But Dr. Marsh or General Hoyer, Governor Justice, Dr. Amjad, whoever wants to jump in, how do you convince that last kernel, that 25 to 20%, that it really is in your best interest, if medically this thing is proven safe, that you really should take the vaccine? Thank you.
Let me lead off, and then I'm going to pass to our people. But I just lead off by saying this. Look, we have the most stringent guidelines in the land, in our Food and Drug Administration, our CDC, all the different agencies that are looking over this. Absolutely, without any question, the world's standards are our standards. Now, from a standpoint of the safety of the vaccine and everything, I feel like that this will be vetted beyond belief. And what we got to do is we've got to encourage people to get the vaccine. I'll come on TV as quickly as they say that they're going to, that they're going to vaccinate me, and I'll let you watch it again. It's nothing, from the standpoint of that and everything. But with all that, I would just say just this, that it's easy for us to have skepticism, about anything. We're afraid, and the dark in the closet is always a little scary. But in this situation, I absolutely believe we all need to be encouraging. And the other thing I would say is this, and I could be wrong, and that's why I'm going to defer to all of our medical team and everything, let them weigh in. But I truly believe if we have 50% of the people take it, that will, in essence, break this ability for it to go from A to B to C. And every time we break that, we get better. But to eradicate, we need more people, to be tested. But anyway, Dr. Marsh, maybe you could start.
Sure. Thank you, Governor, and thank you, Kenny. And we appreciate you too, Kenny, and all the folks that attend these media briefings and the great questions that you ask. So the governor is completely right. The data that you suggest was that a poll of Americans, as I understand it, found that if the vaccine was over 50% effective, a certain percent of Americans would take the vaccine. If it was over 75% effective, an even higher percent of Americans would be interested in taking the vaccine. And there's really two sides to this story. The first side is that we want, as the governor said, to start to create blocks in that chain of transmission from person to person. And we know to get foundationally effective concentrations, numbers of people that are immune in West Virginia, to really block that, we think this is going to be more around 70% or so of people who are vaccinated and immune in West Virginia, or who have immunity from being previously infected. And so that's really important. That starts to reduce the spread of COVID-19 and protects the transmission in West Virginia, which protects our most vulnerable people. But the other side of the coin is really very important as well, which is protecting each West Virginian from getting the virus. And we know that the virus can be deadly to people that are older or have pre-existing conditions. But also we know now that the virus can have long-term impacts, side effects on people that may survive the virus, may even do okay through the beginning parts of the virus, but then have secondary problems like heart problems or fatigue or even fuzziness in how they think or loss of the taste or smell for a long period of time. So we also want to protect each West Virginian from the side effects, the impact of the virus. So we want to make sure, as the governor said, it's a very safe virus. The Federal Drug Administration knows that every eye is on them, so they are doing a particularly thorough evaluation of all the data from the clinical trials, which have been completed for Pfizer and soon will for Moderna. And so I know that that's going to be a very safe vaccine going forward. And like the governor, as it passes FDA approval, I certainly will not hesitate to take the vaccine myself or have my family take it when it's available for all of us based on its safety. And it is a superbly effective vaccine based on the numbers that we see now. So thank you for your great question, and I'll pass it on to other members of our panel.
Kenny, I'll just add, I think it's important that we continue to work to do these events like we do each Monday, Wednesday, and Friday, and we continue to educate. I know Dr. Amjad and a team of folks in DHHR, along with Dr. Deb Kieser from Marshall University and others, are working on educational materials to make sure that our people understand not just the safety, but the value. So we've got to continue to do that. And the folks in DHHR and our other state partners are working hard at that.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel, to you and your family, and also to the members of the media and the people of West Virginia. A happy Thanksgiving. I have a question about running to the fire and what is going on in Mineral County, where the infection rate has been up around 200 for several days now. I understand it's probably more logistically possible to run to the fire at a nursing home or a prison or something like that. But when you have a whole county involved, how do you run to the fire? And perhaps should members of Mineral County, residents of Mineral County, consider staying at home until this blows over?
Well, maybe Secretary Crouch, you guys or General Hoyer, maybe y'all could, jump in and, answer this. My answer is really simple. We're continuing to consult. Everyone's talking and everything. We're working as best we possibly can. We're trying with all INAs to not shut things down and all that kind of stuff, and keep, trying to go to school and doing the different, all the things we can do. And I know that we're not in school there from the standpoint of where Mineral County is in the red, but with all that being said, Paul, the people of Mineral County and the people of West Virginia should be taking, especially in Mineral County, but should be taking every precaution that they can take, because, I don't think that they need to stay home yet, but, when you just don't have, when it's an unnecessary trip to a convenience store, or whether it be going to Walmart or whatever, and if it's unnecessary, I wouldn't be going. And absolutely, I would be trying with all in me to do whatever I could to be able to pick up stuff for the elderly and my neighbors and whatever, because, I would be doing everything that I could possibly do along those lines. But maybe, if Bill Crouch or General Hoyer would weigh in, please.
Yes, Governor, thank you. We're extremely concerned about Mineral County and have been for some time now. They're averaging over 300 tests per day, but we need to test more. Manpower is always an issue right now in terms of moving resources, but we've tried to help as much as we can in Mineral County. There are, I believe, 10 outbreaks in Mineral County and a lot of community spread. So the governor's absolutely right. People need to protect themselves at this point, wear their mask in Mineral County, isolate as much as you can. We've heard a lot of discussion about smaller groups being the source of spread throughout the state and throughout the country. So be mindful of who you're with and whether or not you're protecting yourself and others. So again, we continue to worry about Mineral County with regard to their infection rate and with regard to the positivity rate. So, General, you have more?
So I'll just again highlight part of what the governor pointed out. And Paul, we continue to provide more testing. We continue to provide more community-based steady state testing, so it's easier for folks to go. But as you pointed out, it's about being smart and individual discipline to do the things that we need to do to still keep our lives functioning, but being able to mitigate this spread.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I know every day we talk about the number of patients hospitalized, the number of folks in the ICU. Could someone address how we're doing in terms of healthcare personnel? Are we starting to see strains there? Thank you.
I think maybe, Dr. Marsh, maybe you could jump in first, and Dr. Amjad after that, please.
Sure. Thank you, Governor, and thank you, Charles, for the question. We do see healthcare workers who live in communities that are also having problems with COVID infections or having exposures to people who have been diagnosed as positives. And so as we are navigating the increased numbers of people that are in the hospital with COVID-19 and in the ICUs, the two sides to the equation, as we've talked about before, is the number of available beds on one side, and then the number of available skilled workers on the other side. But I think that the reassuring point for all West Virginia should be that despite us seeing more people in the hospital, more people in the ICUs, and seeing people in these larger healthcare enterprises also, having some people having, been found to be positive for COVID or have been exposed and are quarantining, that we still have plenty of capacity in the inpatient side and the ICU side. And our ventilator use is not really picked up as much, which is also a good sign, but it doesn't reduce our need to be continuously diligent about making sure that we're protecting this vital asset, and to make sure that we are working very closely with all of our hospitals and our hospital association from the CEO level and the leadership level of these hospitals to make sure that we are continuing to have the capacity to deal with any kind of surge, because as we have said before, it usually takes 2 to 4 weeks after we see a great increase in the number of people that are positive before we see hospitalizations and ICU need go up. And it's particularly important to note that around the rest of the country, we've seen the most people with COVID on a daily basis test positive, and that's been now for the last 20 or 30 days that we've averaged over 100,000 people a day in the United States. We have seen more people hospitalized than ever before, with well over 80,000 people now in hospitals around the country. And yesterday, as the governor said, we saw the highest number of deaths that we've seen on any day since April. And the deaths always lag behind the number of cases and the hospitalizations, but it should give us reason to continue to reinforce that idea that we want to reduce the spread, the environment that promotes and facilitates spread, which is people that gather without masks, that are close together, that are indoors. So those are important statistics, but in West Virginia, we are still doing okay fine related to hospital beds, ICU beds, but we are ever focused on making sure that we are adapting as we need to, because maintaining that capacity is really critical for West Virginia.
All right, thank you, Charles. Next, we'll go to Kelsey Soto with WSAZ.
Kelsey Soto with WSAZ. Governor, you've previously said earlier this week and even last week that schools are safe and that, you know, they're the best place for an education for students. Can I guess you just talk about the significance of the weekly color-coded map then, knowing that under these executive orders, you do have broad powers to essentially allow all schools to be in person?
Well, Kelsey, I think the right way to answer that is just this, is first and foremost, I'm going to listen to the experts that are around me. You know, I'm going to listen to the Department of Ed. I'm going to listen to our medical team. I've tried with all in me to give a lot of latitude to the local level, because, you know, that's how we have set this whole thing up, you know, to where the local level are the eyes on the ground and everything. And so they, you know, within those school systems, the local superintendents and the county boards and everything, they have the latitude to do things there on a local level. But from the standpoint of trying to put together, you know, something that is a metric to be able to measure so we can direct and everything, I'm going to tell you, at the end of the day, I know that the complications and the frustrations and everything with the color-coded map that we have, but really and truly, I think at the end of the day, people are going to be able to walk away from this and say, you know, really and truly, when Harvard came out with that map, if we would have just stuck just exactly to that map, well, for crying out loud right now, you know, you'd have 2/3 of the state shut down. Now, from the standpoint of our kids, from the standpoint of the safety within the schools, we can measure it, can't we? We have only a handful of confirmed cases at just a handful of schools. We absolutely, at this point in time, know without any doubt that the virtual learning is failing us. It's failing us. And we know what damage that is doing to our children. So in other words, we know the level of safety at our schools, and we know how the virtual learning works and everything, and how that is failing in lots of ways. So we also know that local information is better than Charleston-directed information in many cases. So what do we want to do? We want our kids in school, and we want those schools to be dadgum safe. And we want those schools to be safe not only for our kids, but our teachers and our service personnel and everyone else. Without any doubt, without any doubt, period, if all those kids and all those teachers and all those staff would not have been in those buildings at all, and they'd have just been in other places around our state, whether it be a Walmart or a convenience store or wherever it may be, we would probably have more infections than we have by being in the school. You know, absolutely, I want to continue to give the latitude on the local level, but without any question, what I want to try to do is really, with all in me, keep our kids back in school, because those kids, they need to be in school. Badly do they need to be in school. And our teachers want them to be in school. You know, at the end of the day, the overwhelming majority of our teachers are so good, and their hearts are so good, and they want to be with their kids, and they want to try to help, and they know how important it is to be there. I can't answer it any more bluntly than just that. And so that's it, Kelsey.
All right, thank you, Kelsey. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. I wanted to ask about the Game Changer program. Governor, you had announced last week that there they're launching a new promotion, Change Their Holiday, I believe it is called. I realize it's really more of a program that's geared towards the Christmas holiday as opposed to Thanksgiving. But I've had a few people that were asking about it, and I was wondering if you could possibly speak to it for just a quick moment, and maybe give a brief overview on the promotion, if you could. Thank you.
Okay, I'll do it as best I can. Let me just back up and just say this. You know, the whole game changer concept and idea is wonderful. It will absolutely, it's another tool in the toolbox as far as being able to help us with this drug abuse and this situation that has caused us a tremendous amount of harm, especially to our young people. And it's, you know, whether it be Jim's Dream or Jobs and Hope or Game Changer or whatever, there's many different aspects that we need to do to combat this terrible drug killer. Now, and Game Changers, they are doing absolutely terrific stuff. That's all there is to it. Now, the idea of this that they came out with of Change the Holiday, and really basically an infomercial and everything, are coming out with things that they're basically raising money to be able to help people that are having a really, really tough time, to maybe be able to make their Christmas a little bit better, or maybe be able to just buy food, to have food on their table. I mean, you cannot thank their effort enough, and all those that are willing to support. There's so many different businesses that have stepped up, and we couldn't be more supportive. You know, this is just us being great West Virginians and absolutely stepping up in a time of real need and helping one another. And what an incredible effort, and I commend them with all my heart. I'm all in to help any way that I possibly can. And again, I am really, really thankful for all those, you know, the private entities, all the different people that have stepped up to really help, because this will be a difference, and it'll make a big, big, big difference, and especially make a big difference in a lot of homes that are having a tough way to go. So let's all get behind the effort, and I always am a believer, you know, that the giver is the one that wins. The giver is always the one that wins. And if you step forward and give whatever you can give and everything to be able to help in an effort like this, you'll win. I promise you'll win. So anyway, thanks so much.
Yeah, thank you, Matthew. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members, and happy Thanksgiving to all. Governor, I want to go back to the CARES Act funding. You were talking about $191 million has gone out to cities and counties. First of all, correct me if I'm wrong. I think you put $200 million in that account. And so I guess it's urgent that the cities and counties get their invoices in, or they're not going to get paid. Beyond that, what are you doing? What is your staff doing to make sure all the CARES Act money, the $1.25 billion, is spent before December 31st, so you don't have to give it back to the federal government?
Mark, I love the question and everything, because we met on Monday. Again, we meet all the time. We're meeting again, I think, at 3:30 today, you know, and on Monday, you know, well, actually, we met on Friday of last week. We met on Monday, and really, what I was doing is do what I always do, and that is continue to shoot shots right across our bow and challenge our revenue people in every way, from the standpoint of just this. We not only do we want to get all the CARES money out, but we want to make absolute certain that we don't get caught somewhere along the end and not have enough money to be able to fund. And what I'm saying is, let's say we needed more and more update on the value of the testing, how much the testing is costing and everything. From the standpoint of the number that you mentioned, you're dead right. You know, there was $200 million that was bucketed and everything. We're at $191 million and change that have gone out. And from the standpoint, Mark, it may look like that per se, well, the counties and the cities really need to get after it because we're going to leave money laying it on the table. That's exactly the opposite of really what needs to happen. We already on Monday changed that projected bucket to $225 million. it is constantly a little bit of a juggling act because we're really monitoring real closely the unemployment dollars. You know, we have to replenish our fund of $287 million, and that's set aside to do just that. But we continue because our job rate, you know, our unemployment rate continues to decline. We continue to decline in the need for the amount of dollars that we would need in this time period. I mean, just think about it, Mark. We first set aside $287 million to repay the fund that went just completely to zero and to repay that. But then we set aside $400 million for a total of $687 million on day one. And then we modified and we modified and we kept the 287 always there, but we got all the way down to 200, and now we even think we're going to slide even significantly under the 200 in need. Well, what that's going to do is that's going to free up dollars and everything that we need to juggle around and put in the right spots and everything. But we're on this, Mark. And, you know, I love the question, but you can rest assured that we're going to go over 200 million on the counties and the cities. We don't have to worry about them getting to 200. We're going over the 200 for sure. I think 225 will cover that and everything. And from the standpoint of everything else that's going on, we're on it. We're on it, and we're going to make this thing come right to the finish line, just right as it should. And that's, I mean, you know, Mark, I don't know many things in this world, but I'm a business guy. I know numbers, and I know how to absolutely make the numbers work and everything. And that's what we've been doing. That's what we're going to continue to do.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi, I want to take a slight liberty and repeat an old question that didn't get answered last week before I get to my new one. The old question is, do we know how much the vaccine is going to cost? The new question is, last week we talked about another bullet in the gun could be a special legislative session to enact some penalties for the mask order. And at that time, the governor said that he'd like the public to flood his office with calls and call the legislative leaders to express some demand. In my area, I know a large number of the legislators, although not all of them, want a special session. So I wanted to see if there's been any demand for a session since we talked about it last week. Thanks.
David, first of all, first part of the question, I don't think the vaccine is going to cost the people a dime. I think the federal government is carrying the cost of the vaccine. You know, there has been no demand expressed to me, you know, and maybe it's just coming to my people and it's not getting to me. I mean, I'm not creating a situation where I want to hear the demand and everything from the standpoint of a special session, but from the standpoint of this, if the special session is there to be able to legislate, you know, some level of penalty, you know, that goes on if you don't wear a mask. Well, all I would say is just this. I mean, Dave, why do we need that? We don't want to penalize people. The last thing on earth we want to do is take somebody off to jail. I mean, why in the world do we need that? You know, really and truly, all we're doing is creating a food fight on something that truly, we need to keep our attention on the ball here. You know, and really, and we don't need to be running up and down the road trying to arrest people or whatever like that. What I said in the very beginning is just this, and it's just as simple. Our police know how to handle situations. Our business owners know how to handle situations. I mean, for crying out loud, if you're in a bar and you're serving somebody and they're overserved, you know, our bar owners know how to handle situations, you know, and really and truly from the standpoint of all that we have going on in every way, we depend on our police to make good decisions with our people, and they will. You know, we're not hauling people off to jail. We're just absolutely telling you that you know, if someone rolls up at a private business and demands to not leave and everything, and they won't wear a mask, that business owner's got to make a decision. You know, either leave them be or call the police. If they call the police is going to come. The police is going to, they're not going to haul them off to jail. What the police is going to do is come and say, sir or madam, you're going to need to leave. or you're going to need to wear a mask. Now, come on. Let's just get along with each other. Why in the world do we need to escalate things to a level beyond that? I mean, and for those that are sitting out there saying, by God, that's my right, and blah, 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 and all this kind of stuff, and scaring people and everything else, and saying, well, the next thing they're going to do, they're going to shut down this, and they're going to do this, and then they're going to take our guns and everything. Please. We got a real issue here and lots of problems. We don't need to listen to stuff like that because there's no truth to it at all.
All right, thank you, David. Next to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor. This is Emily Allen with West Virginia Public Broadcasting. Can you talk a little bit more about the prisons? I know you mentioned a few facilities with 10 plus cases. How is the Division of Corrections, running to the fire specifically to prevent that from becoming like a larger event like happened at Stevens? Just additionally, we're seeing the Greenbrier is still slated to have its family feast. Can the health experts weigh in on, how events like that could be safe this week and what people should expect if they're going to those?
There's pieces that I can't really hear, but I want to get back to the Greenbrier in just a second because I want to really hear that. But there's, as far as corrections, there's all kinds of protocols that are in place. We're continuing to work in every way. The corrections story in this state is wonderful. I mean, that's just all there is to it. They've done a tremendous job. The amount of fatalities, I think we've lost 2 people, is that correct? In our correctional facilities, I mean, it's amazing, So I think that's the story that a lot of people, whether it be the Guard or DHHR or the local health communities or our DMAPs or not DMAPs, but our Homeland Security people now and all that kind of stuff, for what all they've done, it's unbelievable. It's a great story. I did not hear your question on the Greenbrier. What did you say about the Greenbrier, please?
I was just checking that family feast event is still happening. We see it on the schedule. And also, I just wanted the health experts on the panel to weigh in, if they could, about whether events like that, at the Greenbrier or other venues are safe right now.
Well, let me tell you this. First of all, I really have virtually nothing to do with the Greenbrier, but that's not a dodge. Let me just say just this. I'd bet you big bucks that if you would go to the Greenbrier and you would see how they are taking care of people and keeping social distancing and taking temperatures and wearing masks and doing everything that's going on there, I'll promise you this, that place is not dropping the ball. And the work that the people are doing, whether it be Elmer Capolse or my daughter Jill or all the leadership team and all the stuff that they're doing there, absolutely, they're on their game. And I have no idea what you're talking about family feast or whatever like that, because I just don't know anything about that. But instead of just trying to sit back and throw an unnecessary rock at me, you're wasting your time. They're on their game.
All right, next we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, looks like social media is lighting up over a statement you made earlier today saying that the idea of regulating how many people you should be with at Thanksgiving is ridiculous. Would you like an opportunity to clarify what you meant by that?
Well, sure. I mean, Phil, I'm not saying, let's just have let me tell you, when you sit here for an hour and a half and you talk to the people and you talk and you talk and you try to be as honest as you can be, you expect people to have common sense and understanding. I'm not saying that what we should do is have a feast with a family of 83,915 people there. I am not, and I'm only exaggerating to make my point in every way. I do not think that the normal family gathering of 8 or 10 people, or if it happened to be 12 or 14 people, that is a family that knows how to take care of themselves, I absolutely do not agree in any way that we should be knocking on the doors and saying, how many people are in there? Now, beyond that, I expect everyone out there to have common sense. And I am not talking about gatherings of 40 or 50 people. It's ridiculous. It's ridiculous. Why in the world would I be answering this question? I mean, you know, if social media is lighting up on that, well, more power to social media, you know, but I would just expect you to be smart and to be safe and for God's sakes, we got enough problems in this world. Families can absolutely know what's going on and try to take care of themselves. And many of these people have gotten tested. I'm going to get tested again right here in just a few minutes, you know, but many of these people have been tested and every announcement's out there, you know, about travel and being smart and restricting travel and everything. But for crying out loud, you know, for people on social media that probably don't have a whole lot else to do in a lot of situations, and all they want to do is come up with something to criticize about, or maybe even a question from you, Phil, that's you know, something to just, you know, harp on and everything else that I may have meant, well, it's okay to have 128 people at your house. Well, for crying out loud, you know, it's just silly. Let's just be safe and be smart and enjoy the holiday and love your family, because it's really, really important time.
All right, thank you, Phil. Last question today comes from Sean Stinson with the Pendleton Times.
Yes, Sean Stinson with the Pendleton Times. Governor, I have a question for you as well as the health experts. Pendleton County is listed as green on the county map right now with a positivity rate of 1.84. However, the infection rate is skyrocketing in the last week and is approaching red. My question is a lot of people are looking at Pendleton County being green and they're kind of maybe taking the eye off the ball. Do you anticipate possibly tweaking that system, because you have 11 counties that are green in the positivity rate, but they are either orange or red in the infection rate? And that could be possibly kind of that false sense of security. How do you plan, or are you plan on tweaking anything? And also with the health experts, which one, I guess, is better to be lower in or rather higher in? Is that going to be the infection rate or the infection rate?
Well, let me kind of make a stab at it in the beginning here. The reason we put in the positivity percentage rate, the reason we really primarily put that in was because some of the smaller counties, population-wise, like Pendleton, you know, they could have, you know, just a very few number of positive tests that would just blow them right out of the water on the Harvard map. Yet that they may not have much of a problem at all from the standpoint of community spread or county-wide. They may not have hardly any problem whatsoever, and yet they're out of school, they're out of playing ball. There's all kinds of negative impacts from the standpoint of people tourism-wise wanting to come to that beautiful county and everything else. It's deer season right now. People wanting to come to Pendleton County to deer hunt. All the different vendors and everything that capitalize on that time of year like crazy. I mean, so we put in a double metric. Now the double metric primarily is driven just by this. The more you test, the lower the positivity percentage probably will be. But you know what that does? That enables us in Pendleton County, West Virginia. That enables us to find somebody that didn't have any idea that they had this disease, that had it, and save a bunch of lives. Now, if that's not worth it, I don't know what is. On the other hand, it enables us to be able to get a metric to be able to go to school and be able to whatever, play ball or all the different things that I've already discussed. Now, with all that left over to the side and everything, if what we do now is go back and say, well, we're just going to look at the infection thing, ideally, and what our medical team I know is going to tell you is the more we test And if we only have the infection side, we won't test more, we'll test less, because people are motivated to test less, especially in a county the size of Pendleton, because what happens is the more they test on that one side, all they got to do is just pick up just a few numbers and Pendleton County's blown out of the picture. So at the end of the day, what they're going to say to you is this, is as that positivity rate goes down, which it will, by the more you test, the more people will find and be able to help and stop the spread. And eventually what will happen is the infection rate will come down too. Now, right now, like it or not like it, but the real truth of the matter is just one thing, and that is just this. We're testing a lot in Pendleton County. And when you test a lot, I mean, let's just have some common sense here, okay? If you have 1,000 tests, you're probably going to find a few positive people in 1,000. Let's just say, pick a number. You find 20. You know, what if you tested 100? You'd find 2. You know, but we found 20. There's 18 people here we found that we're trying to do something about. And we're trying to keep them from killing other people or killing themselves. You know, so from my standpoint, and the medical team is glad to weigh in, but from my standpoint, we changed nothing right now.
All right, thank you, Sean. Governor, I'll turn it back to you.
Okay. I really don't have anything. The only thing that I left out was, you know, well, I was the only and just writing down these 2 or 3 things. You know, I wanted to remind everybody about the executive order. You know, as far as standing up the task force on our vaccine next week. You know, I wanted to make mention again of the fact that we need more and more testing in Mineral County. We're doing a lot right now, but with the more we could do, the better. I want the people of Mineral County to know that we've got all eyes on Mineral County in every way, and there's a few other counties, but Mineral County is really where a lot of eyes are on. And from the standpoint of the, you know, doing additional modifications and everything, we don't want to do them, but we may very well have to do them there. From the standpoint, there was a question, you know, about, I don't know what it was called, some kind of feast or something like that at the Greenbrier. You know, I want to again point out that those people there, I know they're on their game and they're doing a heck of a job, and I absolutely also know that there's 1,000+ employees there that are depending upon that income and that job too. And so there, as the same thing all across our state, we want to keep ourselves working. We want to keep ourselves in school. We want to try with all in us to minimize the impact of this killer until we get to a vaccine. And then as soon as we get to that vaccine, I want to encourage every single person that has the ability to take that vaccine to do so. And lastly, I just say again, I hope and pray that everybody has the very best and safe and happiest Thanksgiving that you can possibly have. And God bless each and every one of you. We're going to get through this.